This is Our Lives. I'm Gwen Edwards. From the womb to the tomb, minorities are experiencing disparities in the healthcare system. And COVID-19 brought that to light in very painful ways. So what can you do to protect yourself and your health? Dr. Johnnie Lee is a global medical affairs leader, HIV for Johnson & Johnson. And Dr. Lee, we want to thank you so much for joining us today here on Our Lives.
Thank you for the opportunity.
Let's talk about the lack of trust that's been going on for decades when it comes to the healthcare system and minorities.
In minority communities, there's a long history of mistrust, and it's partly rooted in people's own personal experiences of bias when they encounter the healthcare system. It's partially related to the history that we hear and we know about experimentation that occurred with Black folks without them knowing it. The history is there and the perception is there, and people's experiences even today probably reflect that in some way, and it's real.
Each of us should be savvy consumers when it comes to seeking services in the healthcare system. So therefore, we should have open and honest conversations with our healthcare provider. So what should you do if you feel that your needs and concerns are not being met or being minimalized?
I used to tell patients all the time, really think of your health as one of your most valuable assets, and you have to protect it. And you have to insist that others see it as valuable. You should absolutely speak up. And if you can't get it resolved, if you don't feel like I'm going to get this resolved here, then you need to escalate the issue because everybody is accountable to somebody. And if it's just as much as asking the question, well, who is in charge here? And how do I get this resolved? And if you feel like your healthcare concerns are not being met, then you should seek healthcare from someone else. You should not stay in a situation where you feel as though your concerns are not being addressed, you're being disrespected, or that your well-being is not being valued, because that's really not acceptable. And most insurance plans will actually allow you to get a second opinion. Hospitals specifically have patient advocates that actually are there to address patient concerns. They are there to make sure that any issues that you encounter at that institution are resolved.
Dr. Johnnie Lee, we thank you for your time.
Thank you very much.
And we want to thank you for watching Our Lives, where we bring you information and interviews you will see nowhere else. For Our Lives, I'm Gwen Edwards.
Your